Welcome to Fertility 101, brought to you by Repromed Ireland. Today we're going to be discussing fertility and mental health and understanding and addressing the emotional toll of infertility. My name is Penny O'Neill. I work at Repromed Ireland, and my guest today is Pauline Whyte, a psychotherapist who is specialising in infertility. Hi Pauline, thank you for joining us today. Can you tell us a little bit more about yourself, first of all?
Hi Penny, thank you for having me here today. It's lovely to get the opportunity to talk about what I do on a daily basis, which is working with people who are going through fertility. So obviously there's the physical side, there's the financial side, there's the relationship side, but there's a massive emotional side that sometimes isn't really addressed.
Yeah.
So for the patient to come away from the medical side once they get the diagnosis and they meet with all the medics and the nurses and just have a space purely to talk about what's going on for them, where they're at, how it's affected their lives. And it is a huge shock, generally speaking. So I started out my profession as a nurse and a midwife, which I loved. And then I moved west of Ireland, which is a lovely place. And then I worked in a fertility clinic for 9 years. So worked as a fertility nurse specialist, scanning, doing all the embryo transfers and everything, which I loved. That led me to become very aware of the emotional side of it and how anxious, depressed, isolated, sad, grieving the patients were.
Yeah.
So after 9 years, I went and trained as a psychotherapist, and that's what I've been doing for the last 14 years, working with Repromed clients and people going through treatment.
And what do you find are the biggest emotional challenges for patients going through infertility treatment?
Well, they're varied and they're long. I mean, the big thing is it's unexpected. Nobody really expects that they're going to be the one. We all have the dream. We'll have our babies. It's a societal expectation. It's usually not everyone. Some people indeed choose not to have children. But if it's what you want, you don't tend to expect it. It usually comes as a shock. It's a diagnosis. It's quite difficult to handle. So shock, that then closely followed by grief. It's suddenly the loss of being able to do something that you just presumed you could always do.
Yeah.
So there's a huge grieving process. Then we have anger. We have isolation. They feel it's not something they can talk about. Then self-esteem can be affected, how they see themselves, and it basically can lead, those emotions, those negative emotions can lead to anxiety, depression, and basically affect the quality of their life. So it's really important that they have the opportunity to talk to somebody just to look at those things that will meet them where they're at and let them speak about the emotional side of it.
And do you think society plays a part in making it difficult to talk about going through infertility treatment or having a diagnosis, which means you have to go down the infertility route?
I think it's changing. I'd like to tell you that it is very much spoken about, and there's certainly a younger cohort of patients coming up that are much more open about it. But it's still very common for a couple to say to me in the room, if I'm looking at outside support or who have you told, well, we haven't really said it to anyone, we're keeping it to ourselves. So yeah, there is a societal stigma around childishness. It's something that generally they may not have chosen.
Yeah.
It's something that there's triggers every day. It can be just going to a wedding and 3 people announce their pregnancies or you didn't know they were pregnant. It can be an insensitive remark. How long are you guys married? Any children yet? That can be such a massive trigger for these people that maybe haven't spoken about it. So it's everywhere. And that's what they commonly say. It affects every part of their life. This is something that you put all the effort into and you can't really control the outcome. So it can be very, very difficult for both partners, indeed, not just the female, to deal with this and to accept it.
And can you outline the various stages that a patient will experience going through their infertility journey, if you like? At each stage, is there a certain emotion that is more prevalent, or is everybody different, or do you see certain emotional characteristics happening at certain times through the process?
I think a very good question. I mean, it is a unique journey for everyone. You will find some people that will maybe have had some indication, perhaps if they were diagnosed with endometriosis or knew they always had problems with their periods, and they'll kind of have a more open, and they think, I kind of always knew this was going to happen. Shock being the big one. And then the whole negativity and the whole lack of control is huge, as I've said. And the grieving process and the sadness, huge sadness around it. Acceptance is a big thing. Once they meet the doctor and they hear, okay, this is the problem. There's a huge area then around just accepting that, and they'll very often come into therapy and they just think, why me, why us, so just kind of making sense of it. And some of them might go to Dr. Google and they really try and figure it out. It's just trying to get them to sit with where they're at, what they've been given to deal with, and give them some resources to help them through it.
And do you see it, can it impact on their quality of life, their relationships? Is there feelings of guilt, frustration?
Huge feelings of guilt, frustration, sadness, guilt, particularly within the couple. If it's, for example, a male factor infertility, they can very much go into their own space. And I try to remind them, look, this is a couple, this is your situation together. Because the man might commonly say, but I've no sperm, I've let her down. But, she might want to go up with somebody else. It's heartbreaking. And likewise for the woman, she might say, he's perfectly fine, but it's my egg count or my bloods. So I tried to get them to look at it in a more holistic way and say, okay, together as a couple, this is the second biggest decision. So you've decided to be together, you want to have a baby. Now we've got to try and empower you to deal with this situation without blame. Obviously, it's going to affect your self-esteem. And it can absolutely affect the quality of your life, your work life, your home life, because it's everywhere, isn't it? I mean, You go somewhere, you see a lady in a buggy, you see babies, we've baby showers now. It's just society is very much, if that's the thing that you don't have, that's what you're going to see everywhere.
Yeah.
And people can be very insensitive and they don't mean it. So comments like, any sign of a baby yet or that sort of thing can just really, really hurt them. So sometimes it's about giving them tools just to respond to that. Alice Domer, who's a very well-renowned lady in America who set up what we call the Mind-Body program, and that's to incorporate, the emotional side of it and give patients resources. And she's actually written a very good book called Conquering Infertility. She brought out the Mind-Body program in 1987. One of the things I like most about her is she talks about giving them zingers, which is when somebody makes an insensitive comment. And I often have to do this. You give them a standard reply or you help them. And that's so, for example, no babies yet. Or any little brother for this one, They come up with their own answer and then they have it. And that can really help them in the moment when they're caught in a situation where they just get that, if somebody asks them something or somebody announces a pregnancy. So it's just, again, it's around, empathically listening to them and giving them the resources that they might need. And that can be anything from lifestyle changes to talking to friends and family to forgiving themselves. Because, they do. You mentioned blame. They blame themselves.
Yeah. And so what would you say are the benefits for individuals or couples seeking emotional support, psychotherapy during their journey?
It is nice to be able to say that certainly you do see a difference. Again, if they engage, not everyone will come. We have stigmas in Ireland around therapy. Yeah. We're not yet at the stage where we say, yes, I'm seeing a therapist. And there are people that think, sure, how is counselling going to help me? It is what it is. Talking about it isn't going to make it better. But yes, they come in. They haven't, very often, this is the first place they've spoken about it other than with the doctor, the GP, and then the therapy room. So it's even given them the language to talk about it amongst themselves, to really focus in on how they communicate to each other. It can be very difficult for the wife, for example, the partner to say, I feel I'm letting you down. And they're carrying these emotions and they're not communicating. So that's the biggest thing, to get the couple to look at what the diagnosis is and how they're going to, and give them maybe some resources, get them to reach out to family and friends, just guide them and try and get them into a better place, that they feel more empowered and that they can hopefully have some way of getting through this.
And in terms of how do people contact you, or how long is a session? Do you see people, is it better face-to-face, or do you see people over Zoom? How do you work?
So I work face-to-face and Zoom. Obviously COVID was a big interruption in this, but face-to-face, people were used to it. I will say now, people are getting very used to Zoom. So I basically give the client a choice. If I am based in Galway, so if they're in the Galway area, surrounding area, they come into my rooms, we'll meet. It can be anything from one session to, some people come to me right through treatment, results and indeed pregnancy, because the anxiety doesn't go away once you become pregnant. And particularly then, obviously, if there's a negative outcome, they really need. So a session is 50 minutes.
Right.
I would like to say it's important to go to a specialist fertility psychotherapist if you're with a clinic and, for example, they will recommend somebody. But we have an organisation called the Irish Fertility Counselling Association, which I'm a member of, and our whole aim is to provide emotional support to patients going through fertility treatment.
Any strategies that you can pass on to them that would help them deal with the emotional stress and toll that they're feeling at the moment?
People often want the magic solution, but it takes time. And as I say, it's tuning into what you're feeling. Sometimes we work through anxiety and we try and ignore it. Yeah. So the strategies, the common ones, and you don't introduce them straight away, because if you tell someone to start breathing, they're going to go, how's that going to help me? Yeah. But actually teach them how to control the anxiety, teach them to recognize when their heart rate goes up or when they get that pain in their chest, giving them mind-body techniques, as we said, where that could be a bit of CBT, where we challenge the belief system. I'm never going to get pregnant. We'll never be able, this is going to work. I know it always fails the first time. So you get them to recognise that the thoughts aren't always accurate, and you work with that. And again, techniques like breathing, grounding themselves in the here and now, reaching out for support, forgiving themselves, talking to their partners, and just being gentle with themselves. I always say to them, when you're going through a cycle, this is it's basically down to the actual 5 or 6 weeks. Be careful. Check in with each other if you're saying no. Maybe you feel like going to that barbecue at the weekend. Maybe you just don't want to see anybody and hide away. So just see what suits you, and don't be hard on yourselves. And don't feel you have to tell anyone. But it is a good idea, if you can, to share it, because it can be a very silent, private pain. And it is a pain. It's a real pain.
And in terms of just how many times you would see a client, how often is it? Once a week? How long would a typical session last? How long would the treatment last?
Generally speaking, it can be, for example, anyone accessing donor conception in Ireland. It's part of our now regulations since 2020 that they have to have an implication session. So that can be, if somebody's coming and they're changing to using a donor, that can be one session. Typically, if they're working on and they're experiencing the pain, the loss, the guilt, the sadness, the intense feelings, negative feelings around their diagnosis, it's 6 sessions, just to sort of, the therapeutic relationship, like you and I talking here. You're not going to go in and open up to someone you don't know. They have to feel comfortable. They have to feel that this is a safe space. There's no judgment, and nobody's going to tell me what to do. We don't give advice. We try and say, well, what does that feel like for you? There can be a huge decision-making process if they're going to go ahead with treatment. You know, the doctor will say you need IVF. They might think, well, that's very intrusive. We hadn't really thought about that. So they might just want to work through that. So 6 sessions is kind of just to get to know each other. And then they'll often dip back in and out. And some people, as I said, will come through the whole process. If they're, again, it depends on the type of person you are. You know, some people are extremely anxious. Some people are very, they just take it in the stride and they say, okay, this is going to be difficult, but I'm going to do it. So again, it's about checking in with the individual, seeing where they're at, and working around their needs.
That's been fascinating, Pauline. Thank you so much. So if anyone would like to reach out to you, and is there a way that they can? How would they do that?
Well, I believe my details will be on the Recommend website, just a new website coming up now. And as I said, we have an organisation called the Irish Fertility Counselling Service, so whatever part of Ireland you're in, I think there's about 17 or 18 of us specialised, and you can get names and addresses there. A lot of it's word of mouth, but absolutely they'll find myself and all the other ones on the Irish Fertility Counselling Association.
And also on the
Recommend website,
That's great. Thank you very much. I hope you found the webinar interesting today. Thank you. Bye-bye.
Thank you.